The American Dental Association estimates that over 175 million cavities are filled each year, which means that everyone within the sound of my voice has had or will have a cavity filled sometime in their life, most likely. But what's really going on when you're getting a feeling? So you sit down in the chair, you open your mouth, and the dentist will go in there and they'll be whirring and buzzing and lights and smoke. But what's really going on? That's what I'd like to share with y'all today, with my experience as a dental assistant, observing and assisting dentists for hundreds of hours doing fillings almost every day that I work. Each filling contains about 4 parts, 4 steps to achieve success. It'll start off with a diagnosis, and then we'll have the preparation of the tooth, the actual filling of the tooth, and then some post-operative procedures. So first off, diagnosis. Most diagnoses of cavities come first when a hygienist is cleaning the teeth. They'll usually be using a scaler. They'll be going along, cleaning the tooth off, removing calculus, and discover a small indentation. And that is when they'll write it down, mention it to the dentist. The dentist will make another examination and confirm if that is indeed a cavity. The dentist will likely use an explorer to press down on it to see if it's going to stick there or if it's any deeper. The dentist, if they notice that the cavity is deeper or may be deeper from the surface of the tooth or the occlusal surface, that tooth or that cavity might not seem very deep, but on the inside that cavity can extend much lower. So they're going to use a x-ray, and that will confirm if the tooth really needs a filling or if that tooth actually needs a root canal or even a crown to treat a more profound cavity. So after that diagnosis, then we'll move on to step 2. We're going to prepare the tooth. We'll get that wonderful shot. They'll put in that aspirating needle that everyone loves, and we'll get some lidocaine or some septicaine to numb the mouth. The dentist will go in there with a high-speed drill and actually remove the cavity and all of that tissue around it. The dentist might use some green seek or some caries indicator to get out all the little bits of tooth that are hard to identify with the naked eye. Then the dentist will put some etch on there, which is actually phosphoric acid, which will make some microcorrugations in the tooth to allow the bond to have something to stick to. Then they'll put in some glue in there, they'll call it bond, and use a very high-powered light to cure that bond to prepare the tooth for the actual filling. That gets us to step 3. After we prepare the tooth, we'll start to fill the tooth. The dentist will take a tool, probably a spoon or a condenser, and stuff some composite into that tooth. They might use a high-speed ultrasonic tool, which will actually vibrate as it exudes that composite into the cavity. And then the dentist will take a burnisher to shape the tooth into just the right anatomy, so we'll have those correct sulci and cusps so that that tooth will be functional for chewing or cutting. And then the dentist will use another high-powered light to cure that composite, and that is when we'll move on to step 4, which is our post-operative procedures. The dentist will have you bite on a piece of blue articulating paper, and that'll leave blue little impressions or marks on the tooth to see where on the teeth you are hitting the top teeth or the bottom teeth. And then the dentist is trained to know which of these little cusps should have marks and which shouldn't. The dentist will be able to file down with a high-speed drill any high marks so that you don't have any pain when you're chewing. And then the dentist will advise you to make some changes to your oral routine to make sure you're not back in the office anytime soon with more cavities. So to recap, we start off with that diagnosis to be sure that filling a cavity is really what we need to be doing. Then we'll have preparation of the tooth, where we'll use etch and bond and anesthetic to make sure everything's all prepared, carve out all that bad material. The dentist will then go in there and fill it with composite, and that's going to be our step 3 of the filling. And then 4 is postoperative procedures, where then just will make sure that that tooth is in the right place, that the occlusion or the bite is all right, and then you're on your way. So that's how you get a filling. It is sometimes lengthy, but each step is vital to the overall success of that filling.